I'm a medical student by background, and something that I consistently saw on placement was people from Black and minority ethnic backgrounds coming in with late presentations of certain conditions. And it had me wondering and asking why was this constantly the case and what could be done about this. This is when I was first exposed to the concept of preventative medicine, proactive health, and how we can actually do that.
I've been training people as a personal trainer for about nearly a decade now. And I said to myself, how do I reach more people? I'm the type of individual I want to help people. I believe in fitness for all.
I've lived in my property for 9 years. In the first, 2 weeks of me moving into that property, I developed damp and mould, severe damp and mould within my house, especially the bathroom and my daughter's bedroom.
As a funder, we have access to a lot of resources, mainly money. But we also recognise that funding models as they exist at the moment perpetuate systemic inequalities. They don't involve the people whose health is at stake. People are experts of their own lives, so it's critical we put them at the heart of how funding decisions are made. We partnered with the Wellcome Trust and the Social Innovation Partnership and the people of North Walworth to develop the Giving Lab, which is a great example of innovative community-led funding.
Nurtured is a community hub that provides and signposts Black community members to accessible and actionable resources for enhancing their personal growth and well-being.
Mould Hurts is a project that is aiming to spread awareness about the impact that it has, especially the negative impact on local residents, on their health, mental health and their finances.
Minney PT is your AI personal trainer on your phone. We talk to you in real time, we track your reps, and we make sure you never miss a rep.
I've noticed that other funders are focusing on other things that are just not relevant.
And I think with the Giving Lab, the reason why they made such a big impact was because they're enabling and they're empowering people to go out there and make change that they might not necessarily be able to do because they're not hands-on or they're not on the ground. The trust is the most important thing that they gave to us, and we appreciated that because you don't work well once you're constantly being micromanaged.
One thing I love about the Giving Lab and support that they're giving me is that learning process of how to do a project, how to do a project proposal, how to do a budget. Yeah, it's just giving me hope, I would say. As a community learner, I am helping and guiding individuals, the grantees, from the beginning. Make sure that whatever they need, research, support, advice, that's I'm here for.
If the projects are for the people, it's important to include these people in the decision-making process as much as possible.
It is the people themselves who understand what that personal problem is like. No one will really understand it like themselves.
It's important for other funding organisations to see what the Giving Lab has done.
Ultimately, we want to build trust between funders and communities. That means we can be as impactful as possible and make cities healthier places for everyone to live.